I just like to point out, welcome back. I'm Stephanie Ruhle. That's right, here live. I just ran in from outside. I was really getting ready to get my skate on, and I realized I needed to talk CBO. The numbers are out, and they're a doozy this morning. The nonpartisan Congressional Budget Office says tens of millions of people, they're going to lose their health care coverage if the Republicans' bill to repeal and replace Obamacare is enacted. And I'm in luck. Ali Velshi is here to break down the numbers for me. What
I don't know where your outfit went. That was great.
I mean, that was some like tearaway John Stark.
No, it's good. Good. Let me tell you about this. The Congressional Budget Office. First of all, here are the numbers. According to the CBO, the Congressional Budget Office, their score by 2018, there will be 14 million more additional uninsured people versus what there would have been under ACA, which is Obamacare. By 2020, it'll reach 21 million people, and by 2026, which is as far out as they predict, it'll be 24 million more people uninsured. Now, if you can't keep track of those numbers because you don't know how many people are insured, let me do it for you this way. Under the Affordable Care Act, by 2026, there will be 28 million uninsured Americans. Under this new plan, they say there'll be 52 million more uninsured Americans. So that's the difference. That's the way to look at that.
Now, walk me through premiums, because that's an issue for so many of us. Yes, right. I'm going to get coverage, but what do I actually have to pay?
So before I do this, I want people to remember that premiums are one part of what you pay for medical care, and then there are all these out-of-pocket costs, co-pays and things like that. So those are expected to go higher. But let's just talk about premiums on their own. In 2018 and 2019, you will see premiums 15 to 20% higher than they would have been under the Affordable Care Act. By 2026, premiums will be 10% lower than they would have been under the Affordable Care Act. Now, this is really important. I need people to understand this. Premiums will not be 10% lower than they are today. Premiums have all through history gone up. They were going up before Affordable Care Act. They actually went up a little less during the Affordable Care Act, but they're still going to go up. So your premiums are not going to be 10% less than they are today. They're going to be 10% lower than they would have been under the Affordable Care Act. So that's the thing that you have to remember.
We got to talk seniors. Medicaid, so important to so many Americans.
I wish I could do that, but my board got stuck here. All right, Medicaid, you're going to see $880 billion less going into Medicaid, because what they're going to do is in 2020, they're going to shift into giving block grants to the states. Now, the states at that point will have, thank you for doing that. Somebody in the control room help me out with that. The block grants mean $880 billion less will go to the states. It'll also change the qualifications to get Medicaid. So the estimate is that by 2026, 14 million fewer people will be enrolled in Medicare. So the argument that a lot of people are using is that the states will handle that. They will deal with it in their own way, but there's actually no recipe for it. So the prediction is that 14 million fewer people will be enrolled under Medicare. I'm wondering whether this will let me do it or the control room.
But talk me through the argument that Paul Ryan is making. When there's less people that are getting covered, when there's less money going into Medicaid, the government's got to be saving somewhere.
Yes, actually, the savings are pretty big. And if I could just take a look at what they're going to be, it's going to be about $337 billion. That's the saving to the deficit. So you can't really calculate it as a saving on its own. The deficit will be...
It's a big number.
It's a very big number. However, in addition to this, fewer people will be insured, and there will be tax breaks coming in. So if your argument is just about the deficit, then yes, this gets the deficit lower. But then I would argue that if you offered no health insurance at all, you'd have far less of a deficit, or no Medicaid at all, you'd have far less of a deficit than you have now.
Okay, play politics with me. There's some myths. There are some myths associated with this. Bust them.
All right, let me take a quick look at the myths that we've got. One of them is that you and I are both capitalists. We both like markets. We both get free markets. But one thing we understand is that insurance companies are in it for the profit. If you're not a government or a single-payer system, insurance companies don't want to insure sick people. Insurance companies will not willingly insure them because they're wildly unprofitable. There's no one worse for an insurance company than someone who's sick and old. Correct. So that's not a free market. If you force somebody to do something, it's not a free market. So if you're free marketers, which we generally are, you have to accept that insurance companies won't insure sick people. And here's the other one. There are no federal restrictions on selling insurance across state lines. Everybody keeps on saying that this will allow insurance companies to sell insurance policies across states. There are only two reasons insurance companies don't sell across states. One is that states mandate, they restrict insurance. That's
because
why.
Currently there are some states where you can
WellPoint sells almost everywhere. But it's really hard because insurance systems are based on networks of providers, and that's difficult to establish physically when you're farther from your home base. So everybody says that the federal government is taking away restrictions. Under Obamacare, there are none, zero, no restrictions on selling insurance across state lines. So when you hear this on our air or anybody else's, know that it is absolutely a fallacy. There's no such thing.
All right, healthcare, it's not just important to Paul Ryan. It's not just important to Americans. It's certainly important to the White House. Repeal and replace Obamacare was what we saw throughout the campaign with President Trump. I want to take you live to the White House, where Peter Alexander is standing by.